Video is to set some context for South Cheshire's response to the national call to action for primary care. Let's start by saying that we're all really fortunate to work in a great health service, where there's care free at the point of delivery, from cradle to grave, in a system that, by international comparisons, is already efficient and already delivers high quality care for the investment that is made in it. However, we all also know that the money is becoming tight, and that to cope with efficiency savings of billions of pounds over coming years, we need to think hard and we need to think differently about how we can deliver our health care. What is clear is that doing what we presently do, or even doing what we presently do better, won't be good enough. We need to do things differently. Our health and social care systems are complex and fragmented, and often poorly focused on delivering what it is that those that use the service actually want to see. The organisations that deliver our care are often working to different measures, disparate payment systems, and have their own organisational goals. This all makes it difficult to focus care around the patient. In order to start overcoming some of these barriers, we want to bring professionals together from across various organisations into accountable care teams for them to focus on delivering outcomes. These outcomes would be developed with our patients so that they are recognised by them and meaningful to them. We are calling this solution accountable care systems, a system of contracting based on outcomes and capitation budgets, where the various organisations are tied together by lead or alliance contracting methods. A lead contractor mechanism is when one organisation wins a head contract and subcontracts to other organisations that are needed to contribute to a multidisciplinary package of care. So the lead contractor could be a community provider, it could be an acute provider, or it could be a GP provider organisation. An alternative approach is to use alliance contracting, where all parties are contracted together to deliver the outcomes, but where the contract includes incentives rewarded on a all-win or all-lose basis. I'd like to talk now a little bit about the context within which we wish to build accountable care systems and the work of Barbara Starfield. Professor Starfield was an American paediatrician turned public health doctor who studied international healthcare systems and defined 4 principles that characterise high-quality, cost-effective health systems. And these were continuity of care, coordination of care, dealing with all common problems within the primary team, and dealing with the whole person, not with diseases. We want to incorporate these principles by building accountable care systems, working to these principles as the backbone of our health service. Each of these accountable care systems would be cross-organisational and multidisciplinary, bringing together professionals in accountable care teams, delivering towards patient-defined outcomes. Together, they would deliver the bulk of our care, but importantly, they would be supported by acute and urgent care and specialist care. These services themselves can be commissioned using the principles of accountable care systems, based on outcomes, with continuous improvement cycles, and being professionally led. My question to you at the end of this is, Where do you fit in? And are you ready, and is your organisation ready, to contribute and to flourish in this new way of working?